Okay, welcome and thank you for attending today's webinar. My name is Ilaria and I'm a trainee clinical psychologist at the Waltham Forest team, and I'm studying at the University of Essex, Tavistock. I'm going to talk to you about mindfulness for caregivers of individuals with learning disabilities. So as Ines was mentioning earlier on, it's very important to also take care of ourselves and to help also the people that we're working with. So we're going to talk about this now. Thank you. So first of all, what is mindfulness? I'm sure a lot of you have heard about it, it's everywhere, mindfulness. They talk about it a lot. And this is just a short definition by KABAT-ZINN, who was one of the people that worked with mindfulness for the last 30 years at MIT in the United States. And he defined mindfulness as paying attention in a particular way, on purpose, on the present moment, and non-judgmentally. So let's think a little bit about some of the components of mindfulness. There are 7 attitudinal factors of mindfulness, which come from some of the theories where they come from. So the first one is about letting go. So the importance of being able to sometimes do a step back and let go of the situation that we're going through at the time. Patience is very important as well. That's another quality that is very helpful. Acceptance, and we're going to talk about that in a moment. Non-striving, non-judging, also trusting in the process is very important, and also a beginner's mind that we're going to talk about as well. So is mindfulness effective? I mean, that's a quite good question. There's been a lot of recent research that found that mindfulness-based intervention have positive evidence in treating a lot of conditions, including depression, anxiety, stress, adjustment disorders, compared to the usual treatment. So actually adding mindfulness into the treatment or into the therapy or even in our daily life can actually help us with a lot of conditions, and there is a lot of positive evidence about it. So why mindfulness for caregivers of adults with LD? I mean, that was a quite important question I found, because a lot of research has found that stress can affect a lot of people that are taking care of individuals with LD. Stress normally arises when we perceive that the demand that we have are in excess compared to our coping resources. So actually adding mindfulness into our life can actually be one of our coping skills as well to deal with difficult situations. And the chronic stress can lead to a lot of other psychological distress, and can also manifest in more severe conditions such as depression, anxiety, and also in health difficulties. So it's very important to manage our stress effectively. And also sometimes what happens as well is that the more we get stressed, the more sometimes we have poorer interactions with our clients. So actually that can increase the behavioral challenges, and consequently that can have an impact on the stress level that we perceive. So actually it's a vicious cycle that can occur. So the more stressed we are, the more we cannot have responses to the service users that actually they concentrate on the present moment, the more, and that can lead to also challenging behavior for our service users. So it's really important to manage the stress as best as we can. So let's have a little think about it. There's more research that has been published last year that found that mindfulness-based interventions for professionals, caregivers, can have a lot of positive impact in terms of the rating of distress. And these include especially mindful awareness, increase cognitive diffusion, and also reduces thought suppression. And that's something we're going to talk about it. But the evidence says that the that the results have been very positive. And I was wondering if we might try to practice a little bit of a mindfulness exercise together to see how we feel. So I'm going to play a little video for you. One moment, please. And it comes from actually a training that Dr. Williams has created at the University of Oxford in the mindfulness-based cognitive therapy course. So I thought we might sit back, relax, and try to practice an exercise for the next 3 minutes. Thank you.
Meditation 8. Meditation 8. The 3-minute breathing space. Taking a breathing space. Making a definite change in your posture so it embodies a sense of being awake. Perhaps closing the eyes if that's possible. And beginning step 1 by seeing what's going on in your mind and body right now. What's the weather pattern like inside? What thoughts are around? Feelings are here. Any sensations in the body? Not trying to change anything, but opening to what's already here. Then moving to step 2, bringing the attention to the breath, narrowing the spotlight of attention on sensations of the breath in the abdomen, tuning into the changing physical sensations of the in-breath for its full duration and the out-breath for its full duration. And if the mind wanders, simply acknowledging where it went and gently escorting it back to the breath. And now step 3, expanding the focus of your awareness around the breath to take in the whole body, as if the whole body were breathing now. Aware of your posture, your facial expression, sensations on the surface of the skin, and from right inside the body. Holding in awareness all the sensations in your body right now, just as they are. Coming home to the body. Coming home to this moment.
So thank you very much for practicing with me. I mean, this was just a 3 minutes breathing space, but we can, I notice in my personal experience the difference that it makes in my day, even to have a 3 minute space when I feel quite stressed. This has been found by a lot of other clinicians and researchers around the world on how we can make space for our own breathing and our own emotions as well, to come back to the present moment. So yeah, so hopefully you enjoyed the exercise, and I'm going to talk to you a little bit about some of the 4 mindfulness practices for everyday life. Again, we're going back to some of the theories by John KABAT-ZINN, who wrote a great book that talks about how caregivers can use a mindful approach with adults with learning disabilities, but also with children and other people we take care of. So Again, one of the first principles of the practices is to drop in on the present moment. So as I said, even a 3 minutes practice can be helpful in bringing us to the present moment. There are a lot of neurological changes and a lot of things that change for us when we breathe. We take in control our breathing. It can give us a sense of calmness a little bit, and a sense of present well-being because of also the changes that occur due to the breathing. So dropping back to the present moment is very important. Awareness of the presence is very, very important as well, because what it's saying to us is to choose a time on the day to experiment with bringing full presence and attention to whatever is unfolding. So being fully present is very important because as I said, you know, it can also decrease our stress level quite significantly. So, and also if we get lost in our thoughts, which is absolutely normal, you can always return to the sensation of the breathing, I always try to do, and the body as a whole to ground ourselves and to bring also back the attention to the service users. I've worked as a support worker in the past, and sometimes when there were things that elicited my breathing or my heart to go faster, something that I did was to just take myself away from the present moment, that moment, do some breathing and go back to the situation so that I'm calmer, and you know, it's easier to approach the situation when we're calmer due to the breathing. Something else that also KABAT-ZINN mentioned is importance is to practice this acceptance. We mentioned earlier on that acceptance is an important part of mindfulness. So sometimes when we find that our mind is judging, just notice the content of our thoughts and gently bring back the attention to the moment in the fullest and whatever is happening in the moment. Try not to judge your thoughts and strong emotions. But an important metaphor is to think that they are just like clouds, that they're moving in the sky and they're coming and going. So opposed to, instead of struggling in the moment. So when we're having difficulties sometimes working with the service user, sometimes it's important not to judge too much the situation, but bring it back to the present moment. It's easy very often to go back to the past when somebody's, oh, they always do this or this and that. But sometimes let's get back to that moment, right? Rather than judging always on the frequency of other things that have occurred before. So let's try to bring it back there. Responding versus reacting. So it can be helpful to distinguish between the times when we are reacting automatically with what the service user does and where you respond with greater mindfulness intentionality. So as I mentioned earlier, at times when we might feel that we're losing control and it's important that we settle down and become aware of our thoughts and our breathing. And we can notice everything that arises, and rather than pushing it away, embrace them with awareness and a kind of degree of kindness to ourselves. So as I said earlier, to take ourselves away from the situation just for even a couple of minutes, go back to the breath and be aware of the feelings that we have, but feel them with kindness, because sometimes we can be also judgmental to ourselves and be like, oh, I'm not managing this well, but trying to go back to the present moment. And in that way, we will find that we might even find that we can see even things from the point of view of service users because we're calmer, you know. So hopefully these can be helpful thoughts to consider at times. Also, sometimes when we practice mindfulness, it's helpful to also work with our service users and help them to practice mindfulness themselves. Something very important that I look at is always important to practice the exercises when the service users are in the green and the blue zone rather than the red zone. Because when we are in the red zone, what happens is that we can't think. You know, there's all this information, we get angry and upset, and as I said, our breathing goes faster and we cannot be in the present moment. So it's important that we practice these activities when the service users are in the green area. So when at times they might get back more to the yellow or red areas, we can help them and guide them to go back down by helping them with to get back to the present moment by using some breathing exercises that we can help them to do. So I'm going to discuss with you 3 breathing exercises that I have for service users. I've also got a video on the NELFT website as well, where I'm going step by step to help service users, but you can instruct them as well. So they're quite nice exercises. So the first one is an idea that we imagine that we've got a very, very big, balloon. So the exercise is to ask the service user to put the hand on the chest, just above the tummy, and breathe slowly through the nose and let the breathing out through the mouth, as they were blowing a feather or a candle. Notice how your ribs and your tummy moves when you breathe in and when you move out. So this idea that the service user has got like a big balloon, and then through the breathing out, the balloon becomes really, really small. So breathing out through the nose and breathing out through the mouth. Getting rid of all that big balloon. So that's one of the exercises I have. Another one that I have is very nice because it makes us think that we're blowing the sea into the land. So this idea is to have some lovely deep breath. As you breathe out, we can guide our service user to breathe out all the bad images and the worries and the things they don't like about themselves as they're drifting away. So it's like to get rid of all these emotions through the breath. Another exercise as well that I found quite nice as well are the tense and stretch relax games. So with the hands, to squeeze into the hands like a tight ball, and then pretend it's something really, really precious, and then open up the hands again and spread the fingers and make the fingers grow. So this idea of tension and relaxation, and to see how relaxed we may feel just from temporarily clenching our hand very, very tight and then open them again. So, and then something else that we might practice again to have some consistency, as we have a timetable for service user at times, also to have a relaxation diary and see for ourselves how relaxed we feel after each relaxation. So you can have each day of the week, what did you do to relax? It can be some of the exercises we thought. We could also be some coloring in. It could be anything that brings us back to the present moment. How long did you practice for, and how relaxed did you feel afterwards? So that's something that we can do for ourselves, for our service users, and actually see practically if it was helpful for us. Rather than all just the research, it's helpful to practice it ourselves to see if it works. And here I've got some mindfulness resources. There is Calm, it's a website, it's quite helpful. It's got like really nice soothing music and nice relaxation exercises. Headspace is very helpful. It's great for beginners, and it's really, really a lovely website that you can use to start practicing mindfulness exercises. Insight Timer, really, really lovely. This one is completely free, and there are mindfulness exercises in so many different languages as well, including Italian, my language. So it's really, really nice website. And also earlier on, we practiced the Mark William relaxations. They're all free on YouTube. And there's also a lovely book called Mindfulness, a Practical Guide to Finding Peace in a Frantic World. So I hope that, I gave you some nice materials for today. And I would like to thank you for your participation in today's webinar. And I'm here for any questions afterwards. Thank you for your time.